I will be performing the range of motion test for cervical flexion. The norm for this test is 40 degrees. The client will be short sitting for this measurement and sitting with their back and shoulders straight and their head looking straight forward. The therapist will be standing alongside of the client. The fulcrum of the goniometer will be placed on the external auditory meatus. The stationary arm will be perpendicular to the floor and straight up through the center of the side of their head. And the movable arm will be in line with the base of their external nares. So go ahead and line up the goniometer and take your initial measurement. "100 degrees. Next, give the following instructions to your client. Tilt your head downward without moving your shoulders and move your chin towards your chest. Go ahead and take your second measurement after you realign the movable arm. "140 degrees. Next, subtract your initial measurement from your final measurement for a total of 40 degrees of cervical flexion. There is no passive range of motion test for cervical flexion. Since there are so many delicate and important structures around the head and neck, you don't want to be moving the client's head and neck around if they can't do it on their own, as to be careful not to damage anything. Instead, try to just generally assess what little bit they can move on their own in whatever position they are already in, whether it be a bed or a wheelchair or anything else, and make a note of how they were positioned when you document the movement.